This video is for informational purposes only and does not constitute legal, financial, health, or medical advice. Should you adopt the value-based concept in NEMT? Welcome to the RouteGenie community. If you want smarter, easier, and more profitable ways to run your NEMT business, hit like and subscribe, and let's dive in. What if I told you that focusing on fewer rides could actually make you more money? In an industry obsessed with trip volume, successful NEMT providers are discovering that quality beats quantity every time. Today, we're exploring the value-based model that's transforming medical transportation and why it might be the key to your long-term success. The problem with volume-based NEMT. Most NEMT companies operate on a simple premise: more rides equal more revenue, but this volume-based approach is creating serious problems. First, it prioritizes trip numbers over everything else. Your KPIs focus on how many rides you complete, not whether those rides are efficient, provide personalized care, or minimize patient waiting times. Second, there's zero coordination. Volume-based pricing doesn't encourage NEMT brokers, transportation providers, and medical facilities to work together. This lack of collaboration leads to subpar services where patients suffer. Finally, it's actually more expensive in the long run. When you chase volume, you accept inefficient trips, longer routes, more vehicle wear, higher fuel consumption. You're working harder, but not necessarily smarter. The biggest problem? Volume-focused companies often overlook service quality and neglect their clients' actual needs. What is value-based care in healthcare? Value-based care flips the script entirely. Instead of measuring success by the number of services provided, it focuses on patient outcomes and experiences. The framework encourages collaboration between medical teams and healthcare entities to help patients meet both their medical and non-medical needs. For example, doctors can ensure transportation has necessary medical equipment, elevating the entire care journey by meeting riders' medical needs during transport. Value-based NEMT, a revolutionary approach. In NEMT, the value-based concept challenges providers to market, administer, and measure services based on patient outcomes instead of trip volume. It emphasizes three core principles: higher quality of care, cost reduction, and superior patient outcomes. Higher quality of care becomes your primary focus. This means investing in comprehensive driver training, including patient care basics. It means maintaining clean, comfortable, accessible, and reliable vehicles. You prioritize timeliness through smart routing systems and real-time tracking. Communication becomes crucial, sharing reminders, arrival times, and delay updates with clients. You collaborate directly with healthcare facilities to understand patient needs better and actively solicit customer feedback to monitor outcomes. Cost reduction might sound counterintuitive when talking about quality, but it's a realistic long-term benefit. Higher standards mean higher efficiency. You minimize no-shows and missed appointments while growing customer satisfaction. Over time, reliable NEMT services lead to healthier passengers and lower overall healthcare expenses. You achieve this through eliminating redundant services, avoiding unnecessary trips, adopting efficient scheduling, and better resource allocation. Fewer hospital readmissions occur because passengers can follow their treatment plans. Predictable pricing through bundled services based on outcomes replaces per mile or per minute charging. Superior patient outcomes naturally follow when you focus on efficiency, value, and patient results. Reliable NEMT services encourage clients to attend checkups, treatments, and follow-up consultations. This prevents health conditions from worsening and supports early intervention. New success metrics that matter. Value-based NEMT uses completely different KPIs than traditional volume models. Instead of just counting trips, you measure client feedback, punctuality, average delay duration, no-show rates, coordination with medical teams, emergency room visit frequency, service utilization, and hospital readmission rates. These balanced metrics encourage NEMT companies to offer quality services that facilitate long-term client health. You become more than a transportation service. You become your client's partner in achieving health and well-being. Benefits for everyone involved. The value-based model creates win-win scenarios across the board. Patients enjoy better healthcare access, preventative care instead of emergency intervention, fewer missed appointments, improved safety and comfort, more personalized transportation, and better health outcomes. Healthcare providers see more patients sticking to treatment plans, fewer no-shows, enhanced coordination and communication, and higher patient satisfaction. NEMT companies build closer partnerships with healthcare facilities and passengers, enjoy predictable revenue, retain loyal customers, differentiate through superior quality, and achieve greater operational efficiency. Insurers and payers benefit from lower long-term healthcare costs, reduced hospitalization rates, fewer readmissions and emergency room visits, higher return on investment, and smarter resource allocation through data. Implementation challenges you'll face. Transitioning to value-based NEMT isn't without challenges. Data sharing and integration between NEMT providers and healthcare companies requires establishing communication protocols that enhance collaboration while maintaining HIPAA compliance. Reimbursement model changes involve working with insurers, healthcare systems, and government entities to agree on payment structures that promote quality care. You'll need to define performance metrics, patient outcomes, and potential cost savings together. Regulatory compliance becomes more complex as you ensure adherence to both healthcare and transportation regulations. This requires ongoing training and regular audits. Technology requirements increase significantly. You need accurate, up-to-date performance tracking and reporting systems to improve efficiency and demonstrate value to stakeholders. Technology solutions for value-based success. Modern NEMT software platforms, among which RouteGenie stands as the unrivaled trendsetter, are essential for value-based operations. These systems optimize routing and dispatching while tracking quality metrics, not just quantity. They integrate with healthcare systems to coordinate care, provide real-time tracking for better communication, and generate reports that demonstrate patient outcomes and cost savings. Advanced platforms help you transition from transactional relationships to partnership-based collaborations with healthcare providers. Making the transition. Start by identifying key healthcare partners willing to pilot value-based contracts. Establish clear quality metrics and outcome measurements. Invest in technology that tracks these new KPIs effectively. Train your team on patient-focused service delivery rather than just trip completion. Most importantly, communicate the value proposition clearly to all stakeholders. Healthcare providers, patients, and payers need to understand how this model benefits them specifically. The future of NEMT. Value-based NEMT represents the industry's evolution from a commodity service to an integral healthcare component. As healthcare systems increasingly focus on outcomes and cost-effectiveness, transportation providers who embrace this model position themselves as essential partners rather than mere vendors. The companies thriving in tomorrow's NEMT landscape won't be those completing the most trips. They'll be those delivering the most value to patients and healthcare systems. The choice is clear. Continuing chasing volume in an increasingly competitive market, or differentiate yourself through value-based excellence. When you choose value over volume, you're not just building a transportation business. You're investing in health outcomes and positioning yourself for long-term success. The question isn't whether value-based NEMT is the future. It's whether you'll be part of that future or left behind by providers who understand that in healthcare, quality always trumps quantity. That concludes today's topic. Make sure to like this video, subscribe, and watch the next NEMT insights we've queued up on the screen. To learn more about RouteGenie software and how it supports providers like you, head to the description or scan the code. Until next time.